the ONE sleeping position after 60, even the smallest daily habits can shape how well the body ages. One of the most overlooked is the way you sleep. Doctors explain that a single sleeping position can make the difference between waking up stiff and breathless, or waking refreshed with a stronger spine and healthier lungs. This position is simple, natural, and supported by both modern science and traditional wisdom. It requires no equipment, no medication, and no cost, only awareness and practice. Tonight, the way you rest could become one of the most powerful choices you make for your future health. If protecting your spine and lungs matters to you, subscribe now for more trusted guidance. Share this video with someone over 60 who struggles with sleep or back pain, and leave a comment about your own routine. Together we can spread habits that help seniors live stronger and breathe easier. Side sleeping and spine health after 60. The human spine is one of the most remarkable structures in the body. It supports movement, balance, and posture, and it houses the spinal cord, which serves as the main communication line between the brain and the rest of the body. After the age of 60, however, the spine undergoes changes that make it more fragile and more vulnerable to strain. Discs become thinner, joints stiffen, and bones lose density. This natural aging process makes spinal care a top priority for seniors. Doctors often remind patients that what happens during the hours of sleep can either protect or damage this delicate system. Sleeping position is one of the simplest yet most powerful factors in spinal health. Among all positions, side sleeping with proper support is consistently shown to be the most beneficial, especially for people over 60. The reason is alignment. Side sleeping allows the head, neck, and back to remain in a neutral position that follows the spine's natural curve. When the knees are gently bent and supported with a pillow, the pelvis stays level, preventing the lower back from twisting. This reduces stress on the lumbar spine, which is the most common site of morning stiffness in older adults. When the spine is well aligned during sleep, it has a chance to rest and recover. During the day, standing, walking, and even sitting put pressure on the discs and joints. At night, the body has the opportunity to reduce this pressure and repair microstrain. Side sleeping gives the spine the best chance to perform this repair process effectively. Seniors who adopt this position often notice that they wake up with less stiffness, more flexibility, and better posture. Doctors often say that the spine remembers the position it was held in overnight, which means that consistent side sleeping leads to long-term benefits. By contrast, sleeping on the stomach places the spine in a harmful position. The neck must twist to one side to allow breathing, which strains the cervical vertebrae. The lower back arches unnaturally, increasing pressure on already vulnerable discs. Over time, this can accelerate arthritis, worsen osteoporosis, and even cause small fractures in weakened bones. For many seniors, stomach sleeping also compresses the chest, making it harder to breathe deeply. While it may feel comfortable at first, the long-term consequences for both spine and lungs are significant. Sleeping flat on the back may sound supportive, but for many older adults, it is less than ideal. When lying on the back, the natural curve of the lumbar spine often becomes exaggerated, leading to pressure and discomfort. Without the right pillow support, the neck may tilt backward, causing additional strain. More importantly, back sleeping can worsen snoring and sleep apnea by allowing the tongue and soft tissues to fall backward into the airway. Doctors often discourage seniors with back pain or breathing issues from sleeping in this position, even though it may seem harmless. Side sleeping not only protects the structure of the spine but also reduces pain in surrounding joints. The shoulders, hips, and knees often suffer from arthritis or stiffness after 60. When lying on the side with a supportive mattress and pillows, weight is distributed more evenly, reducing pressure on these joints. A pillow between the knees keeps the hips aligned, while a supportive pillow under the head prevents the neck from bending unnaturally. This combination allows the musculoskeletal system to relax fully, leading to deeper, more restorative sleep. Doctors emphasize that spinal health is about more than just avoiding pain. The spine also influences balance and stability. Seniors with chronic back problems often struggle with mobility and are at higher risk of falls. By maintaining spinal alignment at night, side sleeping helps preserve strength and stability during the day. The benefit extends to daily activities like walking, climbing stairs, and even standing upright. Healthy sleep posture translates into healthier waking posture, which is critical for independence after 60. Scientific studies support these observations. Research on older adults has shown that side sleeping correlates with lower reports of morning stiffness and fewer complaints of chronic back pain. One study conducted in Japan compared seniors who primarily slept on their sides with those who slept on their backs. The side sleepers reported better spinal flexibility, less need for pain medication, and greater ease in daily activities. This confirms what doctors have long observed in practice: side sleeping is protective, not just for comfort but for long-term spinal health. Another important factor is the duration of sleep. Most seniors spend 6 to 8 hours in bed each night. Over the course of a year, this adds up to thousands of hours. If those hours are spent in a harmful position, the cumulative effect can be severe. But if they are spent in a supportive side position, the spine receives thousands of hours of gentle therapy. This is why doctors describe side sleeping as a form of passive treatment. It requires no effort but delivers consistent benefits over time. Practical adjustments enhance these benefits further. A medium firm mattress is ideal because it prevents sagging while still cushioning the joints. Too soft a mattress allows the body to sink, twisting the spine, while one that is too firm may create pressure points. A supportive pillow under the head keeps the neck aligned, while a second pillow between the knees stabilizes the pelvis. Some seniors also place a small pillow behind the back to prevent rolling onto the stomach or back during the night. These simple adjustments transform side sleeping from a habit into a therapeutic practice. The relationship between sleep position and spinal health is so strong that some doctors prescribe posture training as part of back pain treatment. Instead of focusing only on exercises or medications, they encourage patients to adjust their sleeping posture. Over weeks, the results often include reduced pain, greater mobility, and fewer episodes of stiffness. For seniors, who may already take multiple medications, this non-invasive and drug-free approach is particularly valuable. It is also important to note that side sleeping helps protect the nervous system. The spinal cord runs through the spine, and misalignment or pressure can irritate nerves, leading to tingling, numbness, or weakness in the arms and legs. By keeping the spine neutral, side sleeping reduces this irritation and allows the nerves to function properly. Seniors who experience sciatica, for example, often find relief by lying on their side with a pillow between the knees, as it reduces pressure on the sciatic nerve. Beyond the physical benefits, there are emotional ones as well. Chronic back pain can lead to frustration, anxiety, and even depression in older adults. By reducing pain and improving mobility, side sleeping contributes to a sense of control and confidence. Waking up without stiffness means starting the day with more energy and optimism. For many seniors, this simple adjustment makes the difference between feeling limited and feeling capable. In conclusion, side sleeping with proper support is one of the most effective ways to protect the spine after 60. It aligns the vertebrae, reduces pressure on discs and joints, prevents nerve irritation, and promotes long-term flexibility. Compared to stomach or back sleeping, it offers superior protection with no negative side effects. Doctors around the world recommend it because it turns every night into an opportunity for spinal healing. For seniors seeking independence, comfort, and strength, this one habit may be more valuable than any medication or device. Side sleeping for lungs, circulation, and overall health after 60. Breathing is one of the most automatic functions of the body, yet it is also one of the most sensitive to change as we age. After 60, the muscles that control breathing gradually weaken, the ribcage stiffens, and the lungs themselves lose elasticity. These changes make it harder to draw deep breaths and to fully expand the chest. While this is a natural process, the way we sleep at night either worsens or eases the challenge. Doctors explain that sleep posture is not just about the spine, it is also about how much space the lungs have to fill with air. Side sleeping is considered the best position for supporting lung function. When the body lies on its side, pressure is removed from the chest and lungs, allowing them to expand more freely. This deeper expansion means better oxygen intake with each breath. For seniors, who already face reduced lung capacity, this improvement is significant. More oxygen during sleep translates into clearer mornings, steadier energy, and improved brain function. Oxygen is the fuel for every cell in the body, and when its delivery improves, the entire system benefits. By contrast, stomach sleeping compresses the chest, restricting lung expansion. This leads to shallow breathing and reduced oxygen intake. For people over 60, this not only increases fatigue but also worsens risks for conditions like chronic obstructive pulmonary disease, COPD, or asthma. Back sleeping, though less restrictive on the lungs than stomach sleeping, creates another issue. In this position, the tongue and soft palate often fall backward into the airway, narrowing it and leading to snoring or sleep apnea. These interruptions reduce the quality of sleep and place heavy strain on the heart. Side sleeping avoids both of these problems, offering the clearest path for steady, deep breathing. Doctors have long noted that patients with sleep apnea or snoring often show improvement when encouraged to sleep on their sides. Apnea episodes decrease, oxygen levels remain steadier, and sleep quality improves. Seniors benefit even more, since nighttime oxygen drops can accelerate memory loss and cardiovascular problems. A night of uninterrupted, oxygen-rich sleep helps the body repair itself at the cellular level, protecting against both fatigue and cognitive decline. Side sleeping also has profound effects on circulation. Healthy sleep involves what doctors call nocturnal dipping, a natural drop in blood pressure during the night. This dip gives the heart and blood vessels a chance to rest and recover from daytime stress. However, when sleep posture interferes with breathing or creates tension in the body, this dipping may not occur. Over time, consistently high nighttime blood pressure increases the risk of heart attack, stroke, and vascular dementia. Studies have shown that side sleeping supports more stable blood pressure patterns compared to back or stomach sleeping. In Japan, where longevity research is highly advanced, doctors found that seniors who slept primarily on their sides experienced fewer nighttime spikes in blood pressure. Their circulation to the brain and heart was stronger, and their risk of vascular complications was lower. This suggests that the position itself directly supports cardiovascular health. Improved circulation during side sleeping also means better delivery of nutrients to tissues and more effective removal of waste products. Muscles and joints recover faster, wounds heal more efficiently, and the immune system functions more effectively. For seniors who may already face slower healing and weaker immunity, these benefits provide an invisible but powerful form of protection. Another area where side sleeping shows clear advantages is digestion. While this may not be the main reason doctors recommend it, it adds comfort and protection for many seniors. Sleeping on the left side in particular helps gravity move food more smoothly through the digestive tract. It also prevents stomach acid from flowing back into the esophagus, which reduces heartburn and reflux. Many older adults struggle with nighttime reflux, which disrupts sleep and damages the esophagus. By simply turning to the left side, this discomfort is often reduced or prevented altogether. Practical adjustments make side sleeping even more effective. A medium firm mattress supports both the spine and the chest, preventing sagging that could restrict breathing. A well-chosen pillow under the head keeps the neck aligned, ensuring that the airway remains open. Placing a pillow between the knees prevents twisting of the pelvis, which not only supports the spine but also keeps the chest from collapsing inward. Some seniors find that a small pillow in front of the chest helps support the top arm, preventing the shoulders from twisting and allowing for more stable breathing. These small modifications transform side sleeping into a position that can be maintained comfortably throughout the night. Doctors often receive questions about which side is better. The answer depends on the individual. The left side is particularly beneficial for digestion and reflux, while the right side may feel more comfortable for some heart conditions. Alternating sides can be the best solution, preventing stiffness from prolonged pressure on one side. What matters most is consistency in choosing the side position over the back or stomach. Even if a senior rolls during the night, beginning sleep on the side already provides significant benefits. For those with specific health conditions, the impact of side sleeping is even greater. Seniors with COPD often breathe more comfortably on their sides, as it reduces the sensation of breathlessness. Those with sleep apnea experience fewer interruptions and higher oxygen levels. Seniors with heart disease benefit from improved circulation and reduced nighttime blood pressure. Each of these benefits adds up to more safety, better rest, and stronger health. Beyond the medical advantages, side sleeping improves daily life in subtle but important ways. Seniors who breathe deeply and sleep soundly wake with more energy. This makes everyday activities like walking, cooking, or caring for grandchildren easier and more enjoyable. Steady oxygenation at night also supports sharper memory and focus, reducing forgetfulness and confusion. The emotional benefits are equally important. Waking refreshed reduces frustration and anxiety, replacing them with confidence and optimism. Safety is another overlooked advantage. Seniors are at higher risk of falling out of bed, especially if they are restless sleepers. Side sleeping provides greater stability than lying flat, lowering this risk. Families often find peace of mind knowing their loved one is in a safe, comfortable, and health-protective position through the night. Making the transition to side sleeping may feel difficult at first, especially for those accustomed to other positions. Doctors recommend starting each night on the side, using pillows to make the posture stable. Even if the body shifts during the night, the effort to begin on the side builds habit over time. Within weeks, the position becomes natural. Gradual consistency is more effective than forcing perfection immediately. In conclusion, side sleeping is not just about comfort. It is a protective practice that supports the lungs, strengthens circulation, improves digestion, and reduces health risks that become more common after 60. It turns every night into a healing opportunity, providing the body with better oxygen, steadier blood pressure, and deeper rest. The benefits extend into the day, improving clarity, energy, and independence. Doctors worldwide agree that while many factors shape healthy aging, the position chosen at night is one of the simplest and most powerful. The position you choose each night may feel small, but its impact is lifelong. Side sleeping, with the right support, strengthens the spine, protects the lungs, steadies circulation, and allows the body to rest in the way it was designed to. After 60, every decision that preserves independence and vitality matters. This simple change requires no medicine, no cost, and no complicated routine, only awareness and consistency. By turning to your side tonight, you are giving your body the gift of healing, repair, and renewal. Small choices build into lasting strength, and this one choice can shape every tomorrow.